Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to Five to Thrive Live, a podcast about thriving for those who have been affected by cancer and chronic disease. I'm Dr. Lisa Schuler, and I co-host with my good friend Carolyn Gazella. You can find all of our past show podcasts on any major podcast outlet and a schedule of our shows on ithriveplan.com. So tonight I will be talking with Dr. J.J. Dugoua about natural relief for chemotherapy-induced nerve pain. So Dr. Jean-Jacques Dugoua, or Dr. JJ as he is affectionately known, is a naturopathic doctor, clinical pharmacologist, and researcher. He's the chief medical officer of the Liberty Clinic in downtown Toronto and the first naturopathic doctor to practice at the Toronto Western Hospital Artist Health Centre. He has done research with the Mother Risk program at Sick Kids Hospital and was an associate professor at the University of Toronto Leslie Dan Faculty of Pharmacy. He has a PhD in pharmacy sciences from the University of Toronto. He's co-author of 2 textbooks, has lots of peer-reviewed scientific publications, and is considered a world expert on natural health products, pharmacology, pregnancy safety. He's an avid public speaker and does presentations, including at the World Health Organization. So before we get to Dr. JJ, I do want to thank our sponsors. We have Cetria, a patented form of glutathione, clinically proven to raise blood glutathione levels. And glutathione is the body's major antioxidant and the primary defense against free radicals. You can learn more at cetriaglutathione.com. We also have Cognizin Citicoline, which is nature's way of keeping the brain working on all cylinders. So if you want to enhance your brain's function, including your memory, focus, and attention, look for Cognizin on the label or go to cognizin.com for more information. We also thank Pro Thrivers Wellness Supplements, including Pro Thrivers Wellness Sleep, a supplement which combines higher dose melatonin and other sleep supporting natural ingredients designed specifically for thrivers. And you can find Pro Thrivers Wellness Sleep at pureformulas.com. And finally, Dr. Ohhira's Probiotics, a best-selling probiotic for over 30 years with 12 probiotic strains, which are shelf-stable without refrigeration due to a unique 3-year fermentation process. And you can learn more at drohhiraprobiotics.com. So with that, welcome, Dr. JJ.
Hello. Thank you for having me, Lise.
Absolutely.
Thank you.
Yeah, it's great to talk with you. You and I have had the chance to meet each other finally after kind of dancing in the same circles, working on a board together over the last couple of years. It was really a pleasure getting to know you and your vast knowledge base. So we're going to tap into that a little bit tonight and talk about nerve damage and nerve pain from chemotherapy. And, for this condition, medical options can be limited, but there's actually some excellent naturopathic natural therapies available. So let's start, though, with first describing why nerve pain or how nerve pain can happen as a result of chemotherapy.
Yeah, so I totally agree with you. I mean, naturopathically, I really think that's where we can make a big impact with this. I mean, first of all, we're often seeing patients after they've done their chemotherapy. I know it'll vary from state to state, but at least I know in Toronto, people are a lot of the oncologists are a little bit uptight about allowing us to do too many things during chemotherapy sessions. So you're often getting, these folks after the end of their treatments. But naturopathically, once they have their neuropathy, it could usually help to have it resolve faster. And the meds are, there's duloxetine, but the meds, are not great. But so basically, a lot of this is fun. From doing some research on this, a lot of this breaks down to, mitochondrial damage, which basically mitochondria is the energy center of, all living cells. Just in particular, the nerve cells, the neurons have higher demand of energy. So when their neurons get damaged, you get issues with respect to its firing too much or too little. If it's firing too much, then you have pain, or you could have cold sensitivity, like what you'll get in like platinum-based chemotherapies. Too little, you'll have like numbness, tingling. How they describe it is that usually when it starts, it feels like you've got a glove around your hand or a glove around your foot. But it could go through the whole body, and it can last for years. So basically, mitochondria damage, you basically damage the energy center of the cell, and then the cell can't repair itself. There's more reactive oxygen species, so more. We always talk about antioxidants. So basically, these oxidants are damaging the function of the neurons themselves. There's different there's calcium channel, potassium channel blockers that are interfered with. That's pretty much it.
Yeah, that's a lot. So it is, I
So,
think that,
yeah.
a key takeaway from that is that the damage is to the inside of the nerve cells and preventing the nerve cells from transmitting signals to each other, in essence, through a variety of mechanisms. So, and that obviously, when that gets interfered with, that can result in the feeling or the sensation of pain,
Yeah.
itching, discomfort, burning, like you said, kind of a compressed feeling, especially in the hands and the feet. So, which chemotherapy drugs are most likely to cause the peripheral neuropathy?
Yeah, I mean, commonly you're looking at your platinum-based ones, so your cisplatin, your oxaliplatin, your carboplatin. So those would be your platinum-based ones, which are commonly used in breast cancer and other cancers. You have your taxanes. So it's interesting because the taxanes are originally from the Pacific yew tree. So when people say, "Oh, natural stuff doesn't do anything," well, the Pacific yew tree makes they derive the chemotherapy agents from it. Nowadays, it's mostly synthetic or semi-synthetic. So you'll find it from there. Some other ones too. There's what is was it vincristine, vinblastine could also cause that. And you have some non-chemo drugs too. I mean, these I mostly see more for multiple myeloma treatments. Like you'll have what's that one called Revlimid. You'll see it's an immunotherapy or some other drugs too. They're protease inhibitors, like what's it called? Velcade is another one too. So, but more commonly you'll see with like the platinum-based ones and the taxanes. So those are
Mhm.
usually whenever you see the issue. So,
Yeah, and this question is sort of a setup for my next question
yeah.
because it does make a difference, right? The type of chemotherapy agent, even though the end result might to the patient feel the same, the mechanisms are a bit different for each chemotherapy class, if you will.
Hmm.
So, therefore, is there one size fits all from a natural perspective, or do you have to know or take into account the chemotherapy?
I think you do. I think you do need to. I think you do need. Well, definitely. I mean, you'll know as the patient, and you know as a naturopathic doctor what original medication they had. Um, to a certain extent, yes. But if you think of something like an alpha lipoic acid, which does so many things, you talked about glutathione at the top. I mean, alpha
Mhm,
lipoic acid helps to recycle glutathione, vitamin E, vitamin C. It has a good effect of trying to protect the neurons. That one,
mhm,
the data is actually there is some data on both actually, the taxanes and the platinum based ones. So that one, I don't like to apply everything, but that one
mhm,
maybe. Some
mhm,
other ones you could. It depends. It'll depend on the drug they've received. It also depends on the incidence. Like when I was looking at this, they say on average 30%, but some other studies are like from 12 to 67. I mean, that's a huge range.
mhm,
Right? Someone comes in like, 67% of you will have this, or only 12% of you. I mean, that's quite a lot. So,
mhm.
um,
Yeah.
yeah, yeah,
So what else about I mean, alpha lipoic acid, as you mentioned,
yeah.
does have applicability across a variety of therapy agents and can be amazing actually in its ability to reduce peripheral neuropathy, pain related to peripheral neuropathy. What else would you like to tell us about alpha lipoic acid?
Yeah, I mean, ALA is pretty well studied for diabetes, diabetic neuropathy. I know when we had it IV for a while, and then we lost it, and then it came back. I used to use it, and I found it worked quite well. And it doesn't have to be fancy and being IV. Orally, I find it works just as well. Just if you do it IV, it sometimes accelerates when people need to have the nerve pain go away quicker. Like recently, I've used it for post shingles neuropathy, and that worked actually quite well. So yes, I mean, yeah. So alpha lipoic. So basically, again, back to antioxidant recycling the other antioxidants, and increases the glutathione in the neuronal cells. Increases glucose uptake in the neuronal cells. So if they're getting more glucose, the cell is able to make more energy. It increases like the conduction, the nerve conduction. It's a good one across the board generally for neuropathy. I don't like to use panaceas, but it's a general good one across the board for really any type of neuropathy.
hmm
Yeah.
Okay, well, one that's a bit more recent on the scene for this indication anyway is
Mm.
saffron, and a lot of
Oh,
people are familiar with saffron as as a spice to use in cooking, but it also is a medicinal part. It's the little tiny, like what we call the pistils of a flower, so it's just the very center of the flower that's dried and then used. But why is saffron potentially helpful for nerve pain?
yeah, it's interesting because we had a naturopath who's Persian, who gave us this quite a detailed saffron lecture back in February, and she was talking about how the reason why it's so expensive. Like, if you ever bought saffron, so that little tiny container, and it's a fortune. It's what when if you go to Indian food or Persian food, it's what makes it orangey. But you're right. It's like it's the stamen, right? Yeah, it's a stamen, little stamen
Yeah,
in each
stamen.
flower.
I think I used the
Yeah,
wrong botanical term.
yeah, yeah. Is it stamen or pistil? Stamen. Wait,
One of them.
whatever. One of them. One of the two. Anyway, doesn't matter.
Botanists, we are not.
Botanists, we apologize. And she was saying that they have to pick them by hand, which I thought was like, I didn't know that. She said they can't make a machine to pick them.
Mm.
So the reason why it's so expensive is they're going through the field picking these little tiny little. And it was super interesting. And she went to the long traditional Persian medicine history of it. Like, you could have it as a tea, you could have it as a pill, et cetera, et cetera, et cetera. And she was talking about it more in terms of its mental health benefits. And I was looking for, I couldn't find, but they looked at it along with the medication, and they found it combined well with one of the mental health meds. But I couldn't find the name. I didn't get a chance to find it. But anyway, yeah. So basically, it seems to have analgesic properties, antioxidants. See this trend, everything antioxidants. That seems to help often. That seems to help in peripheral neuropathy. Also happens to be an antioxidant, anti-inflammatory, antidepressant, some memory enhancing benefits too. And they had a study on it. So this was a platinum based chemo. Decent study. I mean, 170 something patients. And they found that the patients that had received the saffron had less nerve pain, had better. There was a scale they used, but they had improvements in their peripheral neuropathy compared to the group that didn't. So,
Mhm.
and this is like dosed because it's so expensive. It's dosed at a lower value, so that's normal. Don't expect to see like 1,000 milligrams of saffron. I mean, that would probably cost like $500 a pill. I'm exaggerating, but so it's dosed at a lower dose, and it's quite effective. So yeah, it's neat.
Yeah.
It's neat. Yeah, it's neat.
It is, and yeah, there's a whole emerging body for saffron. I mean, it's interesting because it does seem to be very active in the neurological system. There's some data that suggests it might be useful, for example, for depression, and
Yeah.
it also has been shown to help with low libido, which is can be a manifestation of depression. So, and those issues, of course,
Mm,
can concur along with the peripheral neuropathy. Which is one
mm,
of the advantages of natural agents, right? It's usually targeting multiple things, so it's not just one
mhm.
result.
Yeah. Well, also too, and I saw another study where they said that it helped to prevent liver toxicity. I hadn't seen a lot of its use in liver, but
Mhm.
seems to be liver protective, kidney protective, which kidneys are fussy. They're hard to, you don't want to have
Mhm.
anything too damaging to the kidney, and bladder protective too. Think of UTIs, your immune system's weakened. I don't know, all these things are beneficial. So,
Yeah, for
and
sure.
and you could take it as a tea. I know the speaker was saying a lot of them in Persia, they just take it as a tea. So, you might
Yeah.
not get therapeutic doses, but maybe as a maintenance, once you've kind of, getting some improvement, you could continue as having it as a tea. That was kind of
Mhm.
neat. Yeah.
Well, from another traditional
Mhm.
system of healing, we have henna. So henna is used in parts of Asia as a temporary tattoo. It sort of dyes the skin kind of a deep orange-red color for a period of time. And there's been a study, at least one, I don't know, maybe you know of more, about using henna for uh, platinum-based neuropathy. So tell us more about henna and
Yeah, yeah.
what's going on with that?
So this is like, I'm not making this up, but I was at a wedding today,
Mhm.
and it was a Catholic Canadian guy, and he was marrying she's a Sikh Canadian bride, and she was covered in henna. That's what they do in
Mm.
India, South Asia, Sri Lanka, etc. So they henna their hands. So I was asking a ton of questions. I was like, so, what is it like? How did they get this on you? How long does it stay? I'm giving a talk on neuropathy tonight on henna, and they're like, really, really? So I asked a ton of questions. So I know nothing about henna. I'll have patients come in and their hands are hennaed, and they'll be like, oh yeah, I was at a wedding, and no. I'm like, oh, okay. It's quite pretty. I don't know if you've ever seen it. It's
Yeah,
very
I
good.
have. Yeah.
You have
Beautiful.
it? Okay, it's
Mhm.
beautiful. Like, they do it by hand, eh? It's art. It's quite pretty.
Mhm.
So basically, it's like a paste, and they just draw it on your hand, and then you let it dry overnight, and then the ink goes into your hands, and then it stains it, and it gets a bit darker with time, and then eventually it fades. So it's not a tattoo. It's just like a temporary type of thing. But anyway, but in this study, they took this henna paste, and they put it on, what was it? It was the uh, palms of the hand, the palms of the feet, and the fingers, and the entire fingers. And I assume they would have left it overnight, because that's what you commonly do. And they found an improvement in neuropathy, which I thought was kind of neat. I mean, you would have seen, a little bit of staining of the hand, but if it's your palms, it's a little bit easier to hide. And if it's your bottom soles of your feet, well, I mean, no one's usually looking at the bottom soles of your feet, so that's a pretty good way of, kind of being inconspicuous. So, and it had great outcomes, which is pretty neat. So,
Mhm.
yeah, yeah, henna.
Yeah,
Yeah,
it's a good one. I've actually had a couple of patients try it, and
yeah,
they've all reported that it definitely reduced the pain. I think there must be some anti-inflammatory effects from the herb that's used in the henna
yeah.
paste that's, getting absorbed into those little nerve endings there.
Yeah, 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 I would think so. Apparently, it's very smelly though. That's the only feedback I had when I
Yes.
asked my.
Yeah.
Yeah, it doesn't. Yeah, and you also see it in like hair dye, like natural hair dyes too. You'll see they'll often use henna. So
Right.
yeah, it's cool.
Okay, so that's a good option though, because it's inexpensive and people can
Yeah,
find it usually at Indian grocery stores if they're curious about that.
yeah,
Um,
yeah, it's
okay,
true.
so another one from the Ayurvedic tradition is turmeric root,
Hmm.
which is the source of curcumin, which is a component in turmeric that some people may be more familiar with. But anyway, turmeric can be used for some chemotherapy-caused nerve pain. So tell us a little bit more about that.
Yeah, turmeric. To turmeric. I mean, I sometimes wonder, what does turmeric not do? Anti-inflammatory, liver support.
It doesn't deliver my groceries, that's for sure.
Exactly. It's working on it. It's almost there. I saw it used orally, and I wonder, after looking at the henna stuff, wonder if you could use it topically. Because I had a fellow come in like 10 years ago, completely different condition, and he dislocated his kneecap, and I saw him the next day after he dislocated it, and he just unbandaged it because he tightened it, and it was bright yellow, and I was like, "Oh my God, what happened to your kneecap?" Saw all the bruising, and it starts off
Mhm.
yellow as it bruises, and he's like, "Oh no, it's way better now." He said the yellow's from the turmeric. So he
Uh-huh.
thought of just I told him to take turmeric, but he didn't. He just said, "Oh, I'll just make it into a paste," and he packed his knee, and it really said in a day it really sucked up a lot of the inflammation. So I wonder if you could use it topically. I mean, there's no
Sure, yeah,
studies on that, but why
that's
not? I mean.
interesting. Huh.
Yeah, I wonder, right? Same thing too. You do it palms of your hands, your feet. Who
Uh-huh.
cares? Your hands are, I've had patients use it for carpal tunnel, thumb tendonitis, anything like that. So, anyway, I digress. Sorry, I'm going off topic. But yeah, so it's been studied. I've found a study on leukemia where they gave it for 3 months, and so definitely decreased symptoms of peripheral neuropathy and sped up their recovery. But it was one of the few things that I've seen that actually seemed to prevent it, which is interesting. So people did this during their chemo and actually seemed to have a lower incidence to be more preventative. Because a lot of the stuff I've read, there's some like acetylcarnitine actually doesn't help; it actually makes it worse. I mean, I think metformin, there could be something there, but a lot of it, there's not a lot that it really prevents. But the turmeric seemed to have a preventative effect, so which is
And,
super neat.
JJ,
Yeah.
was that actual do you remember in that study whether it was turmeric
It
or
was
curcumin?
curcumin. You're wrong. Yeah,
Yeah,
sorry.
curcumin.
Yeah, I was wrong. Yeah, it was curcumin. It wasn't turmeric. It was curcumin. Yeah,
Yeah, so
it was
that's kind of
curcumin.
important because
Yeah.
curcumin does not have the same risk of drug herb interactions as you know. And in fact, there were a
Mm,
couple of studies done out of Iran, I believe, that demonstrated that people with a variety of solid cancer types getting a variety of chemotherapy agents, taking, I think in that study, they used kind of any kind of turmeric, whether it was turmeric root extract or curcumin, but in both cases, there was no interference to the effect of the treatment or, and in general kind of improvement of quality of life. So that's always important, right, during chemo, just to make sure we're
mhm.
not gonna interfere with the chemo.
Yeah, oh, absolutely, and I think and now, I find the oncologists, at least here, are very concerned about the very mild blood thinning effects of turmeric, which I
Mhm.
think is just very, very mild, but if you're doing curcumin, curcumin is it's not a blood thinner, so,
Right, yeah, so
yeah,
curcumin is
yeah,
probably the safer way to go in this
yeah,
case.
yeah.
Um, so, this great overview of some, supplements that we can take. What about acupuncture for
Aha.
nerve pain?
So I find acupuncture helps. I find the effect of acupuncture can be temporary, but it usually builds on itself. I mean, I'm talking more about classical acupuncture. I know there was a study on electroacupuncture, which didn't really seem to help, which is unfortunate. I don't do a ton of electroacupuncture. I've never particularly loved electroacupuncture. I find you should sort of just let the needles do their own things. And, for those of you not familiar with acupuncture, these meridians running through your body and, through this very old system of traditional Chinese medicine, which is over 6,000 years old, you're basically trying to move qi, energy, vital force, circulation, etc., through these meridians. So normally, if you stick a needle in a spot that it's numb, you start to get circulation, blood flow, nerve supply. I mean, when I did my what's that internship, where were we again when we were in our fourth year, whatever we're called, or
Resident?
residents, I guess, interns, yeah, residents, interns. We had a HIV clinic, and the meds are a little bit better now, but the meds at the time, everyone almost had neuropathy, and you'd stick needles in someone's hands, and they'd be like, I could feel my hands, I could tie my shoelaces, and it'd probably last for about 3 or 4 days, and then they'd come back the next week, and we'd just keep building on that. The reason why it wouldn't last as long is because the medications would be every day, and they'd keep damaging the nerves. But it helped. I found classical acupuncture to help for pretty much most neuropathy. Along with something else will definitely help to speed up the process. Can it be a permanent fix? I mean, sometimes yes, sometimes no. You need, herbal supplements, other treatments along with it to kind of support it. But if you allow someone a day or two or three to be able to cut their own vegetables, like, to some of this neuropathy, if it's really bad, like you can't cook for yourself because you can accidentally cut off your finger, right? So it can get quite bad. Cold sensitivity. I mean, if you live in a cold state or a cold province, winter would be hell. You're going to freeze all the time. Or even in the summer, the AC is crazy. I don't know about where you live
Mhm.
these, but it's like it's bananas. I
Yeah.
actually wear a hoodie in the summer indoors because it's freezing. It's like it's ridiculous. So,
Mhm.
I'm on a tangent. So, yeah.
Well, I think that, it is important to I mean, what I wanna highlight in what you said is acupuncture. I too have found acupuncture to be very useful, but it is during chemotherapy, a bit short-lived, so, gives substantial relief for that period of time, but it does need to get repeated. So I typically, if I'm gonna recommend it, try to get people to get it at least twice a week. That seems to kinda sustain them a bit better. And on a similar vein, red light laser. So this is sometimes referred to as cold laser.
Hmm.
They're just like handheld devices. There's medical grade, and there's also a lot of now red light lasers that people can purchase on their own. Have
Hmm.
you used this for chemotherapy-induced nerve pain? What do you think?
I haven't. I've used it for shingles nerve pain, but I haven't used it for chemo nerve pain yet. But I mean, I think it would help. I mean, there's some data on the laser being useful for that. I haven't used a ton of laser, Almost felt like it was a bit of a fad for a bit, and then I see it less used in practice by the chiros and the physios and so on. Now the LED red lights, I mean, you get them at Costco. Is and their the research on them is they keep constantly pumping out research for skin repair, microcirculation. I haven't seen anything specifically for cancer neuropathy, but it does seem to have a benefit for mitochondria. So it seems like one of the protein, cytochrome C. What's cytochrome C? Is a protein? Anyway, one of the components of the mitochondria apparently could take in the light directly from those red LEDs. So I found it's been helpful. Definitely, the patient we had, we're doing alpha lipoic acid. So that's the thing with naturopathic medicine. We're normally doing multiple things at the same time. But we did acupuncture on her, we did alpha lipoic acid, and we're doing red light. And it definitely, once we added the red light component, it did seem to accelerate her recovery. So I found use. I use it. If I have some chronic aches and pains, I almost use it every day, and I found it very beneficial for me. So
Yep. I agree. I think it's great for pain. And I have had patients report that it does help with the neuropathy symptoms a bit, again, a bit short-lived, but certainly helps in the recovery phase. Once the chemo's done and they still have lingering neuropathy, it can speed the healing along with TENS. And I just want to give a shout out to TENS. I find trans electro nerve stimulation, I think is what it stands for, transcutaneous, but works great. And especially for, on the feet, they have these things you can buy now on any, Amazon or whatever. And you just put your feet on this device, this sort of like foot kind of pad type of elevated foot pad type of thing. And it sends the TENS stimulation right into your feet. And that can be pretty amazing, actually.
That's cool. Okay, I'll look for that. I'll mention that.
Yeah.
That's really cool.
So, what did we forget? What about glutamine? I think glutamine, that used to be so popular, and then it got kind of a bad rap because there's some cell studies that suggest it could accelerate tumor growth. Although, in my opinion, you'd have to take so much glutamine to do that. It becomes a little bit nonsensical, but nonetheless, it's not as common. But boy, for taxane-induced, like Taxol, Taxotere-induced chemotherapy, I find high-dose glutamine just for a few days, starting the day of chemo for a few days after, to be very helpful at reducing neuropathy. And even actually, I've had patients come in who have had taxane, they got neuropathy, never went away, and then I give them glutamine for a period of time, and they start to experience some healing. So I think that's definitely got some good indication too.
Yeah, that's great. Yeah, I used to use it for oral mucositis and just general GI issues, and then the study came out that it could be feeding the cancer, and patients are usually worried about that. They read up on it, and then they're concerned about glutamine. And I mean, my thought around, and probably your thought too, is just if someone's in treatment, they're the glutamine is not going to make its way to the cancer cells. First of all, cancer cells love sugar. Their preference will always be sugar. But if someone will be so depleted, if you're trying to repair the gut or other mechanism, if you give them a short-term dosing of glutamine, I think that's fine. Would you leave it forever? I mean, probably not. I mean, we don't know, but probably that'd be playing with fire. But like you're saying, they're in treatment, right, during chemo. So I think it'd be okay. If the patient's okay with it, because they'll look up on it and they'll be like, well, you're giving me this, and I'm worried about that. And so
I'm very fine with it short term too. So what other thoughts or ideas would you like to leave with our listeners?
What else? I read up on these cold gloves and cold socks, kind of like the cold cradle people wear to preserve their hair. I haven't seen anybody being offered that though at the hospital. So I don't know if you've seen that.
Yeah, no, I usually tell my patients to get a pair of cotton socks, wet them, and a cotton gloves, wet them, put them in an ice chest, and bring them with them to the chemo infusion center, and then wear them. And 2 pairs is good, so that if they're in a long infusion, they can switch them out. And all it does is just prevent the capillary blood flow into the surface of the hands and feet, so there's less chemo circulated to those areas, less neuropathy, less nerve damage.
That's a great idea. It's a great hack. That's good thinking.
Yeah.
Yeah, because I know for the cradle caps, they normally rent them and all that. So
Right. Yeah. And then that same idea just freezes the hair follicles so it less
yeah,
circulation up there. Well,
yeah,
gosh, this has been a good show, such an important topic, and I want to, just thank you for taking time out of your wedding, post-wedding celebration to join us.
you're
Um,
welcome. Thanks for having me.
yeah, so where can our listeners find you? Do you have a website or any social media you can share?
Yeah. Instagram is AskDrJJ, Ask Dr. JJ. Website's AskDrJJ.com. That's probably fine. I have a YouTube channel. I forget what it's called, but
Okay.
yeah, could
So the
probably find it
website
to Ask
is
Dr.
is
JJ.
askdrjj
Yeah,
.com. Okay.
AskDrJJ.com.
Okay.
Yeah, it's
Well,
great.
thank you,
Thanks, Lou.
Dr. JJ. It's been a pleasure speaking with you.
Likewise.
And that wraps up this episode of 5 to Thrive Live. Again, I'd like to thank our sponsors, ProThrivers Wellness Sleep Formula, Cetria Glutathione, the superior glutathione to support liver and immune health, Cognizin Citicoline to help enhance memory, focus, and attention, and Dr. Ohhira's award-winning, shelf-stable probiotic. And thank you, listener, for joining us. May you experience joy, laughter, and love. It is time to thrive, everyone. Have a great night.